What is binge eating disorder? Binge eating disorder isn't the same as occasional overeating. Plenty of people eat too much once in a while. Who hasn't had a stomachache after a huge Thanksgiving dinner? People with this eating disorder, though, feel compelled to do so on a regular basis, at least once a week over a period of 3 months or longer. Who is at risk? Anyone can develop binge eating disorder, regardless of race, sex, age, or weight. It's believed to be the most common eating disorder in the US. Although women are slightly more likely to have it, men can also get it. More than 6 million Americans, 2% of men and 3.5% of women, will have this condition at some point in their lives. Men are more likely to have it in middle age. Among teens, 1.6% have binge eating disorder. How it affects weight. Many people who develop binge eating disorder also struggle with their weight. Among people with the disorder, about 2/3 are obese, and one study found that as many as 30% of people who seek weight loss treatment may also have it. People who are overweight or obese are also at risk for related health issues like heart disease, high blood pressure, and type 2 diabetes. It's about mental health. Many people with binge eating disorder also have other emotional or mental health problems, such as depression, anxiety, bipolar disorder, and substance abuse. They may also feel stressed, have trouble sleeping, and struggle with low self-esteem or body image shame. What causes binge eating disorder? Experts aren't sure exactly what causes eating disorders. A mix of factors, including a person's genes, psychology, and background, may be involved. Dieting can lead to binge eating disorder, but we don't know whether that alone can trigger it. Some people may be extra sensitive to food cues, such as smells or images of food. The disorder can also result from stressful or traumatic life events, such as the death of a loved one or being teased about weight. Recovery is possible. If you think you might have binge eating disorder, know that it can be successfully treated. The first step is getting a diagnosis. To do that, a doctor or other health professional will give you a physical exam and ask questions about your eating habits, emotional health, body image, and feelings toward food. Treatment: help with thoughts, feelings, and food. Talking with a psychiatrist or other counselor is key in working on emotional issues. Cognitive behavioral therapy (CBT) aims to change the negative thought patterns that can spark binge eating. Interpersonal therapy (IPT) addresses relationship problems that may be involved. It also helps to work with a nutritionist to learn healthy eating habits and keep a food diary as you're recovering. What about medication? Certain medications, such as antidepressants and specific anti-seizure drugs that can help control food cravings and urges to binge, may be useful when used along with counseling. Vyvanse lisdexamfetamine, a medication used to treat ADHD, is the first drug to be approved by the FDA to treat binge eating disorder. It is not clear how the drug works, but studies have shown that Vyvanse is able to help reduce the number of binge days per week. Losing weight with binge eating disorder. Binge eating can lead to weight gain and make it tough to shed extra pounds and keep them off for good. As part of their treatment, people with binge eating disorder may need help with that. Traditional weight loss programs may help, but some people struggle with strict diets. Ask your doctor whether you could benefit from a specialized weight loss program for people with eating disorders. Prevention. If you're at risk for binge eating disorder, you can take action to avoid getting it. Watch for feelings such as guilt, shame, or being impulsive around food, or having low self-esteem. If you have these kinds of issues, or if eating disorders run in your family, talk to a doctor or a therapist.